how do antiepileptics act? Now, the mechanism of action of antiepileptic is tough. There are a lot of drugs to remember, and it's tough to remember all of these at once. So I'm going to simplify it for you. First, you should remember why exactly does epilepsy happen? What is epilepsy? Or what is a seizure? Mind me, these are two different terms. Epilepsy and seizure is those are different. Now, epilepsy is, in a broad way, it's due to dysynchronized dysynchronized depolarization. So, epilepsy or a seizure is due to dysynchronized depolarization of neurons in the brain. So, we all agree that epilepsy is basically a depolarization of neurons. So, depolarization of neurons, we have to stop the depolarization. So, what could be the mechanisms by which we can stop this depolarization? First, obviously, everybody knows that depolarization is mainly due to sodium channel influx. So, we can stop this sodium channel influx by using sodium channel blockers. So, one of the main mechanisms by which anti-epileptic drugs act is by sodium channel blocking property. The next way to inhibit this depolarization is to open the potassium channels. Potassium channel openers. Now, what will potassium channel openers do? They'll open the potassium channel, which will help the potassium to go out of the cell and cause repolarization of the cell, and hence inhibit depolarization. Another mechanism by which depolarization takes place is by calcium channel influx. So what we can do is block these calcium channels. Calcium channel blockers. Now, there's another way by which we can block this or reduce this depolarization is by increasing the levels of inhibitory neurotransmitters in brains like GABA. So we have drugs which increase level of GABA. Similarly, we can decrease the level of excitatory neurotransmitters in the brain, which is the excitatory neurotransmitter is decreasing level of glutamate. So, most of the anti-epileptic drugs that we are going to study fall in these 5 categories. Mind you, there are there are some drugs which act by multiple mechanisms as well. Example, valproate, lamotrigine, levetiracetam. These drugs act by multiple mechanisms. One thing you should remember, which is a former NEET question, it was asked in NEET, that which class of drug does not belong to an anti-epileptic drug? The answer to that was a potassium channel blocker. Potassium channel blocker, it's a very important MCQ, does not function as an anti-epileptic drug. Potassium channel blocker. Remember, so there are 5 classes of drugs: sodium channel blockers, potassium channel openers, calcium channel blockers, drugs which increase the level of GABA, and drugs which decrease the level of glutamate. Next section we are going to study all these drugs.